I'm really honored to be invited to speak at an inaugural event by Dr. Field and the Planning Committee. This is an issue that's important to me. I'm an occupational medicine physician, and I'm involved in clinical care, research, and I've seen quite a bit of arthritis. I started out as a rural family practitioner for 10 years, went back and did occupational medicine training. Really my interest is in rural occupational health and agricultural health and safety as a component of that. Now, before I get too far along, Mark had asked me if I had a joke to tell, and the last time I told a joke at a conference, the only person I heard laughing was myself, which is rather awkward. So I've learned my lesson, and just to go get started into my talk. But I think that this is a very important topic, and I really look at you as being pioneers in bringing this back into your states and getting this to be a high priority topic. And I think it is something that you will, let's see here. Now, I'm looking for the button to press here. Maybe it is because of that. Do I just press? Okay. No, that's not it. Let's see, which button do I press here?
Where's your presentation saved at? I'm sorry, I thought you
I thought it was up already. I'm sorry.
Had it pulled up.
I apologize. Now, one of the things that I'm involved in is disability. And so occupational medicine is a preventive medicine specialty, but I see people for workers' compensation treatment. I work with industry in prevention for decreasing workers' compensation cases. And I also do disability evaluations for Social Security. And it's, I don't have numbers to back me up, but I've seen more farmers applying for Social Security disability. I do the evaluations, thank you. I don't make the decision whether a person gets disability, but I'm asked, what is a person's capabilities? What can they do? And that's what Social Security looks at, and whether a person receives Social Security disability. And I've just been struck by an increased number of farmers, in my perception, that are applying for Social Security. What I want to do today is just to give an overview of what is the impact of arthritis on the ability to farm into the agricultural industry, to talk about some of the common agricultural tasks that lead to osteoarthritis and musculoskeletal disorders, what are some of the injuries that occur as a result of agricultural work, and what are some of the technological advances that are used to prevent musculoskeletal disorders and the impact of arthritis. There's going to be other discussion in the conference. I look forward to Dr. Hughes' presentation tonight. I'm not going to talk about treatment of arthritis, and there's going to be more in-depth discussion about ergonomics, but I want to give an overview of some of the issues. One of the things I am going to talk about is musculoskeletal disorders. Now, arthritis affects bony tissues. Musculoskeletal disorders are soft tissue. But the same forces that make arthritis worse and can lead to arthritis affect musculoskeletal disorders. So the state of Washington, Bureau of Labor and Industry, define musculoskeletal disorders as non-traumatic injuries of soft tissues. And these are tendons and nerves and blood vessels and cartilage. By repetitive motions, awkward postures, and use of vibrating tools and equipment, manual handling of heavy, awkward loads. These aren't injuries, but these are things that can lead to occupational illnesses. So there are two categories. First is acute injuries, slips, trips, falls, and the significance of this is that these injuries can lead to arthritis later on. Injuries to joints can lead to the development of osteoarthritis at a later time in life, and also make arthritis worse if the joint already has arthritis. And then musculoskeletal disorders is a cumulative trauma, repeated forces and repetition that lead to damage of the soft tissues and can lead to arthritis. This is an important issue. NIOSH, National Institute of Occupational Safety and Health, in their National Occupational Research Agenda does highlight the priority area of reducing the incidence and the rates of musculoskeletal disorders that's related to work practices and production agriculture. So this has been highlighted as a significant issue. And why is arthritis a concern in agriculture? Well, we know agriculture is an industry that's at risk for the development of osteoarthritis. Now, there are many types of arthritis, rheumatoid arthritis, psoriatic arthritis, gouty arthritis. I'm going to talk mainly about osteoarthritis today, which is the most common and which can arise from agricultural work practices. And also, people working in agriculture often have less access to health care and are often not appropriately treated for symptoms of arthritis. The leading cause of disability is pain. And if people's pain isn't adequately treated and addressed, it really impacts on what a person is able to do. And underinsured, the majority of dairy farmers in Wisconsin are underinsured. Look at farm workers, many don't have insurance. So this is an issue for adequate treatment for the impact of arthritis. And I don't mean to steal anybody's thunder, but that's a nice thing about being keynote speaker. You can go ahead of everybody else and you can give your information and make the others scramble to decide what they're going to talk about. But there is a national agenda, joint effort by the CDC and the Arthritis Foundation and the National Public Health Agenda on Osteoarthritis that was developed in 2010. And this is the goal to set the national policy in osteoarthritis. And because there is a concern that the increasing prevalence of osteoarthritis, the health impact, and the economic consequences, that should be OA, not AO, will decrease dramatically in the next several decades. And this is the URL, the website for that agenda. And I just highlighted a few of the key elements of the osteoarthritis agenda. I should have the first one in bold also, but the self-management education, which is a critical piece of managing the effects of arthritis. And this can apply to other arthritis also, not necessarily just osteoarthritis. But low impact, moderate intensity, aerobic activity, weight management, and improving the workplace environment to prevent the onset and progression of osteoarthritis. These are some of the key elements that I will talk about today, but also how to deliver evidence-based interventions for adequate treatment, quality and equal access to evidence-based interventions, evidence-based medicine for effective treatment, and then more call for research and evaluation of these methods to prevent arthritis. And why is it important? Cost, really does come down to cost. It's medical costs are increasing at greater than the rate of inflation. I consider myself part of the problem. I'm a practicing physician also. The cost of medical care continues to increase. Lost wages from people being unable to work. They're given restrictions, and the employer, the producer, isn't able to accommodate those restrictions. And decreased productivity in times of labor shortages. I'm sure Indiana isn't that much different than Wisconsin, but farmers are scrambling to find workers for their operations. Just a couple of key factors. There's 27 million Americans with osteoarthritis. We look at there's mentioned that there's 50 million Americans with arthritis. So osteoarthritis is greater than half of that. It was already mentioned earlier today about the obesity epidemic and the increasing epidemic of arthritis. It's expected that 1 in 2 Americans will develop symptomatic knee osteoarthritis, and if a person's obese, that increases to 2 out of 3 will develop knee osteoarthritis. There's 632,000 joint replacements due to osteoarthritis each year. 25% of people with knee OA have difficulty doing major activities of daily living. 11.1 million outpatient visits just for OA. And it's estimated that $13.2 billion is spent on job-related OA. So this is part of the facts from the National Osteoarthritis Agenda. The proposals for Healthy People 2020 also have objectives for osteoarthritis. Decreasing the level of joint pain, reducing the limitation of activity, reducing the impact on employment, increasing access to healthcare providers with those that have arthritis for adequate treatment, and then increasing the effective evidence-based arthritis education as part of self-management. I'm looking forward to I think Dr. Hughes is going to be talking about some alternative treatments for arthritis. But what is the effective treatment for arthritis? I mean, it's a critical piece of this puzzle. So looking at agriculture, farmers have a high risk of hand-wrist arthritis, about 3.5 times greater risk compared to non-farmers. Muscle pains is high in multiple crop activities, tends to be lower in horticultural. And we're not really dealing with landscape or horticulture here today, but that's one of the top 12 industries with the highest rate of musculoskeletal disorders in Washington. And horticulture is considered part of agriculture. The other concern with arthritis is its impact on secondary injuries. You know, if you have arthritis, you can't move as fast out of the way, you're less stable, you don't have the same grip, you don't have the same strength. Studies out of Iowa reported that those that had diagnosed arthritis or rheumatism had a 3 times greater risk for animal-related injury, getting kicked, stepped on, crushed, and 2 times greater risk for fall-related farm injuries, falling off equipment. And in New York, there's an increased risk for severe farm injury with about a 2.5 times greater risk in farmers that had self-reported joint problems. So this really has a secondary impact upon injuries that may result in hip fractures, dislocations, other types of fractures that are extremely costly and lead to a prolonged period of disability. In a study I did in Wisconsin, we found that there's an increased risk of arthritis in northern Wisconsin dairy farmers with about a 25% higher rate of arthritis compared to a non-farming population. So when we talk about musculoskeletal disorders, I would include arthritis as part of that. You know, also bursitis, other joint-related problems. But we also talk about spine, disc herniations, back and neck strains, tendonitis, rotator cuffs, which actually can be a consequence of developing arthritis of the shoulder with continued pinching and pressure on the rotator cuff. And it doesn't take as much force for a 50-year-old person to have a rotator cuff tear compared to a 25-year-old. 25-year-old, you have to have a lot of force. For a 50-plus-year-old, all it takes is pulling hard, and you have some arthritis pointing down in the rotator cuff. That can lead to a tear. So just some common facts. Osteoarthritis tends to increase men at 45, women at age 55. You know, the average age of farming now is 55 to 57, depending on the state you're in. So really in that age range for arthritis. Tends to affect the weight-bearing joints or the ones with a lot of force. So you look at the base of the thumb is a common area. Knees, hips, spine, great toe. And just having that, having arthritis in your thumb, it's hard to grip on things. Your knee or your hip, you get that sudden give, which can affect the balance and lead to falling. Now it's more common in some families. My father had hip arthritis, his sister had hip arthritis, and lo and behold, I've got hip arthritis. And so some of it tends to run in families. More repetitive activity can accelerate the development of arthritis. And then we all know the symptoms. It's pain, and that's really the factor that leads to disability and impairment and ability to do your job and just do activities of daily living. But stiffness, swelling, thickened joints, and you can see that in multiple types of arthritis. But morning stiffness is very common. Now this was mentioned earlier by Amber, osteoarthritis. Arthritis in general is a leading cause of disability due to pain and impaired ability to do tasks. It's greater than heart disease, cancer, and diabetes as far as its impact on disability. I looked at some national AgrAbility data some years ago. In 2001 and 2002, arthritis was the primary cause of disability in 4% and secondary in 12% for referrals to AgrAbility. Other musculoskeletal conditions accounted for 38%, over a third, for referrals to AgrAbility. In Wisconsin, look back at a 12-year span of time, 1990 to 2002, arthritis was about 10% cause of disability for Wisconsin referrals. It'd be interesting to look at some of those statistics now, and I'm sure that it's increasing. And I don't know if that's going to be reported in the conference, but I'd be interested in talking to Dr. Field about follow-up on some of the statistics. Now, we really don't know what the disability rates in U.S. farmers and ranchers are. Dr. Du Bois and Dr. Field and others in the Purdue group wrote a paper on this that we published in the Journal of Agrimedicine. It was estimated between 1 and 2.25 million people in farm, ranch, and agriculture had disability. That's not all agriculture, but there's it affects a significant number of people. You look at other countries. In Ireland, about 6% of farmers reported disability, and a third of that was from arthritis. So it affects farming in other countries also. So I want to switch over and talk about some of the risk factors in osteoarthritis. Question of genetics. At this point, there's not a available clinical blood test to determine the genetic marker for arthritis, but I think about in my situation, I worked hard I worked hard physically when I was younger. I can't say I work hard physically as a physician. A lot of sitting, a lot of computer work now. I think about my father and my aunt and with their hip osteoarthritis, and I see it developing in myself as I age, to the point that it affects my ability to function. I can't do some of the things that I used to do. But heavy physical work beginning at young age is an issue, and there's concern about that. Think about your kids, your grandchildren, what kind of activities do they do on the farm? What have they been involved in at an early age? Is it appropriate for some of the things that they've done at an early age? Obesity. Obesity is defined as a body mass index over 30. A couple of years, it was about 2 years ago, and when I went in for a physical and I thought, oh man, I crossed over that line. I'm now in the obese category. My body mass index has risen over 30. Obesity when young is associated with a 5 times greater risk for hip arthritis. So young people who are obese are facing the risk of hip arthritis later in life. Also, female gender and obesity are greater risks. So lack of exercise and other diseases affecting joints. So you can have some secondary osteoarthritis if you have arthritis from another cause. I want to talk a little bit about obesity because it is a significant risk factor. It's associated with arthritis associated with obesity, age, and gender. Apart from farming. Farming itself can be a risk for arthritis, but if you have additional risks as we age, for obese, and males tend to have more arthritis than females. In Wisconsin, we saw the same thing. Wisconsin dairy farmers showed an increasing risk of osteoarthritis with increased body mass index affecting the hip and the knee. This is concerning information. Body mass index from 25 to 29 is considered overweight. 30 and over is obese. So when we look at 23 to 25, that's in the recommended range. So just increasing somebody who went up to a body mass index in the upper range of accepted range to somebody who's below that, there was a 4 times greater risk for knee arthritis in men, 1.5 in women. And then that was in Sweden. Looking in Cyprus, I mean, some of these studies come from other countries, but there was a 10 times greater risk for knee osteoarthritis if the body mass index was greater than 28 compared to less than 22. So pounding this point to death. But just in Wisconsin, we've seen that obesity has increased 91%. It went from 11% to 27% from 1990 to 2006. Nationally, it was similar, 11.5% to 25%. So just comparing Wisconsin to Indiana. In Wisconsin, 29% of the population is obese, 66% overweight and obese. Indiana, 27% and 68%. This is really concerning, I think. In Wisconsin, 23% of Wisconsin high school students are obese or overweight. In Indiana, 30% of youths ages 10 to 17 were overweight or obese. So these are, and I can tell you from experience, once you start to gain weight, it's really hard to decrease it. Once you decrease your ability to move and ambulate, to do activity, it's hard to control weight. So this is really something that needs to start at an earlier age, because it's really difficult as you age, as you become less active. So that's part of when they talk about the increasing epidemic in obesity and how that affects arthritis. They're really tied closely together. Now we want to add agricultural work. So we're working in weather extremes. There's wet, slippery surfaces. This leads to slips, trips, and falls, leads to the need for secure ambulation, balance. The natural positioning of produce, it's bent, it's awkward to harvest it by hand. Just the physical characteristics of agricultural produce, it affects the work conditions, and the equipment makes a difference also. There's a difference between a tractor 30, 35, 40 years old compared to newer tractors as far as suspension, the ride. That makes a difference, the whole body impact. A lot of stoop work in agriculture, and that's defined as 40% or more work below knees. And that leads to low back pain, neck pain disorders affecting muscles, ligaments, and discs. Certainly some people with arthritis are just not really capable of doing that without significant pain in trying to maintain that position. Leads to knee disorders, poultry processing, heavy lifting, high repetition, a lot of hand force, awkward postures, with bent wrists, hand and wrist arthritis, and leads to injuries also. And this, you can see this in swine production also, in finishing and farrowing operations. Looking at dairy, and I do a lot with dairy. When I was in Minnesota before I went to Wisconsin, I dealt a lot with pork production and swine operations. Now I work more with dairy. But there's the old, I'm not sure how well that comes across, but the old stanchion tie stall operations, which are typical up to about 100 cows milked, in the smaller operations. And now we're moving, certainly the push in Wisconsin is for bigger and bigger dairies, moving to parallel and rotary milking parlors. And that's made a difference in work. So with the dairy parlors, rather than stooping and squatting, there's more of the reaching. And so there's a lot of repetition. Stripping of teats can lead to hand-shoulder syndrome, wrist and hand tendonitis, rotator cuff injuries. I'm seeing more shoulder injuries from this. So it depends on parallel, you're reaching straight in. Herringbone, you're reaching in more from the side. Rotary tends to be more rotating parallel operations. Some of the Swedish studies, there's more and more studies coming out of the US now. A lot of the early studies came from Sweden, but they saw hand-wrist symptoms from cleaning, pre-milking, attaching the milking units. And some of these operations, 1,500, 2,000 cows that are being milked 3 times a day. I mean, these people are moving. I've watched them, I've videotaped them, and there's not much downtime. It's just constant activity. You milk 300 cows, that's the difference. It's a slower pace, but still a lot of repetition. And they actually compared this to fish processing, and in these newer dairies, there's higher velocities, more extreme positions in dairy than there was in fish processing. Well, we really don't know how many people have musculoskeletal disorders. It's underreported, it's undocumented. The farm culture is to work until you drop. It's just to keep going, pushing yourself, not taking the time to go in to be treated. And that extends to workers that are hired also. So it's really just the culture of agricultural production is to overlook things and to wait until it gets really bad. And that can have an impact, a significant impact later. There's less reporting because there's less workers' compensation coverage in agriculture. People are working in agriculture are concerned about losing their jobs. They don't want to report it. So all these issues lead to we really don't know how many people have these conditions, but we know it's underreported. you look at migrant workers, Julia Earle Richardson out of the New York Center for Agricultural Medicine and Health found that back, neck, and shoulder strains accounted for over 1/3 of the occupational health problems at migrant health centers. California, some older reports, about a quarter of migrant workers had back pain, upper back 20%, wrist 18%. So these are from cumulative trauma, repetition. And these are the things that we really try to control. Force, repetition, and especially force and repetition together are the ones that really lead to the problems. Posture and stoop work that leads to pain. Pressure from pressure points from tools that are inadequately designed for a person. Tools are for men, they're designed for men. Very few are designed for women or children, and so it's inappropriate equipment. Vibrations can be an issue, and cold isn't a factor itself, but if it's cold, you have to hold tighter. You have to put a lot more force on to hang on to something. So in ergonomic issues, depending on the type of produce, but there can be increasing labor for intensive agricultural work, and there's a lot of this in fruit harvesting, nurseries, small vegetable. Differences for dairy production now, just because of the reaching and the faster pace, higher number of animals. And just some of the pressures from, some of this doesn't apply as much to agriculture here in the Midwest, but certainly repetitive, forceful lifting, pinching, stooping, bending, twisting, all these activities can take their toll if there's not enough recovery time. Orchard workers, they're carrying ladders and full bags, 50 to 75 pounds, grapevine pruning. I'm not sure how much, how many vineyards there are in Indiana, but they're increasing around the country, and certainly with the hand tools, that leads to hand wrist problems. And there's a lot of lifting, bending, and stooping again. Sort of common thread here, a lot of repetition. It crosses over commodities. So look at traditional farming. This had been mainly hip and knee, but also back arthritis. I did 10 years of rural family practice before I went into trained in occupational medicine, and I've always treated the rural community, whether it's in primary care or occupational medicine. I've always practiced in areas where I could practice in rural areas. And I've seen a lot of issues with lost work time because of a back injury, back pain, or other arthritis. But tractor driving had been associated with arthritis. Dairy work tended to be more of an issue in dairy farmers and grain farmers, but because of bending and squatting in the in the tie stall operations. How many people? I know we have people that farm in the audience. How many still have to turn around and look behind them when they're operating? Okay, so it's still present. I mean. There has been, movement in the newer equipment with mirrors so that it avoids some of the constant turning and looking behind. So just looking at hip and knee arthritis in agriculture, there's a dose response. 1 to 10 years, there had been about a 2 times greater risk of developing arthritis. This goes up to as much as 9 times greater risk if you farm for greater than 10 years. Agriculture has very strong associations with the development of hip osteoarthritis just by farming itself. Take away obesity, take away age, just looking at farming, and it is a risk. Tends to be more in hip osteoarthritis than knee. But this is an interesting, in looking at French farmers, 40% of people reported the development of arthritis before age 50 in heavy labor jobs. And arthritis was considered as a heavy labor job. So arthritis was actually developing earlier in people working in these jobs. Also tends to be higher in farmers with higher number of animals, both in dairy or swine, and spending more than 5 hours a day in the barn for a long period of time. These are some of the risk factors. Bending tends to be more of an issue for men than women, at least from a statistical perspective. And then just other pain syndromes, as high as almost a third of farmers reported daily low back pain for a week or more. Shoulder pain reported in the previous year was higher in those in farming than people working in manual labor. And over a quarter of New York farmers had hand wrist pain. So these, when we look at this, the common thread here is intensity of use. What's the force? How much repetition? How many years has a person been exposed? It is all add together. And so these are the amount of time and the amount of force will lead to the problems. Equipment, poor fitting equipment, vibration, and workspace. When I think about poor fitting equipment, again, is some of the tools that are used by women and children that are or had been designed for a typical male. In agriculture and most of musculoskeletal disorders, if you look at the body parts that are affected, descending order, back is very common, neck and shoulder, then wrist and knee. If you look at farming, hip and back would be up towards the top. Now you have to think about other ages too, and this does affect more than just adults. NIOSH has looked at the impact of farm work on children because of the developing musculoskeletal system. The growth centers of the bone are under stress; they haven't fused yet. So depending on how early the child is exposed to some of these forces. Barb Marlenga at the National Farm Medicine Center looked at fresh market vegetable growers, children working in that area, and about a quarter of children reported low back pain, knee and neck pain were reported in about 16 to 18%. Sprains and strains are pretty common in children. And then some of the other factors of concern were weeding by hand, washing and packing produce, loading, unloading, and then tractor operation also, because a lot of children may not be large enough to operate tractors. There's other issues about children and tractors, but this is more of the ergonomic issues. Also, just the improper design again is an issue. And then just think of the work that kids can do on farms, carrying, feeding animals, hay bales, just the manual material handling essentially. And depending on the age of the child, and where are they? I mean, you can have a child, an adolescent that looks like a full-grown male, but their growth centers may not be fused yet, so that can have some impact on the developing musculoskeletal system. And of course, there's a lot of lifting in farming, a lot of repairs, handling equipment, feeding. So heavy lifting is an issue. Low back pain I see it as a common issue in agriculture. It's been estimated that a farmer spent up to 500 hours per year driving tractors, up to 12 to 15 hours per day. You look at the twisting, jarring, and vibration. It depends on the age of the equipment. But there's low back pain is reported anywhere from 20 to 75% farmers with extensive tractor driving, with an average of about 40% of farmers reporting back pain. So what are some of the risks for low back development of osteoarthritis, degenerative disc disease, and in the lumbar spine? Heavy work, load handling near one's strength capacity. What is that? There are NIOSH lifting equations that are generally not applied to any industry, but generally there's been a trend to things coming in smaller containers, decreasing weights, and I think that's extended into agriculture also, as far as some of the feed and seed bags. But prolonged standing, just staying in one position all the time. Bending more than 10 minutes at a time leads to pain, just maintaining an uncomfortable position. And then going on with heavy repetitive lifting, pushing or pulling. Also, the past predicts the future. If a person had back pain in the past, they're more likely to get back pain in the future. Job dissatisfaction, if it's a producer, owner-operator, job dissatisfaction, it's a livelihood, isn't as much of an issue, but it is a significant issue for workers. People that are working that don't like their job are more likely to report pain, they're more likely to go in for treatment of pain, they're more likely to be less willing to put up with pain than somebody who has a significant economic incentive. So, people leave jobs to go find something that's easier. It's a huge issue for labor in maintaining, an adequate agricultural workforce, because people can find, it's just not worth it a lot of times. So that, if a person's not satisfied, that can have a huge impact. Smoking, generally, most people in agriculture don't smoke. The rates are much, much lower. But smoking is connected with back pain. And then you look at some of the activities, weeding, pruning, loading, and unloading. Just a lot, still a common thread of just the forceful, repetitive work. We look at osteoarthritis, in the facets. That's the joints where the vertebrae connect with each other. You can develop degenerative changes, arthritis essentially. The discs narrow, and so you get bone on bone of the vertebrae. And you can develop the spurring. And these are forces that develop from repetitive activity. A disc herniation can combine with the arthritic and degenerative changes in the lumbar spine to put pressure against a nerve, and that's where you get a pinched nerve. You got pain running down your leg. It's called sciatica, radiculopathy. Same names that mean the same thing. We're moving into some prevention. So when we look at some of the assistive technology devices that can make a difference, adding handholds and steps. Now, this is to help prevent the development of osteoarthritis, or at least postpone it, and not add to it. But it also it can be a tertiary prevention. So a person already has arthritis. You may have it from rheumatoid arthritis, may have it from osteoarthritis. Continued jumping, jarring, and impact type of activities can make that worse and actually cause additional progression. So you really look at this as both primary prevention and look at tertiary. But you get power lifts, certainly. This is, and certainly look at the assistive technology more for people that have significant disease. Feeding systems, automated hitching systems, and I believe we'll be seeing some of that on our site visits. Great. But certainly I'm not going to go into a lot of detail because assistive technologies is an important part of this. Just when looking at nursery workers, reaching over, pinching to pick up the 1 gallon pots, so a lot of pinch grip. Just looking at some of the technology, so this a device to pick up the pots for either 1 or for 4. So it leads to a lot less of the impact that can develop osteoarthritis for wrists, hands, and fingers. This is actually from the University of California Agricultural Ergonomic Resource Center. Looking at blueberry harvest rakes, again, a lot of using the old style, a lot of stoop work. Adding a handle would decrease the amount of stooping. Now, one of the critical pieces in these modifications is what's the cost of it? Will workers use it? And for this, it was estimated it took 17 to 30 hours of harvest time to make up the cost of adding a device. So, I think that's the key piece in any ergonomic interventions and new equipment, assistive technologies. For an industry that needs to watch every penny, you really have to demonstrate the cost effectiveness. Otherwise, it's not going to be adopted. So you really have to look at all of these if you're going to make ergonomic interventions. You really also have to come up who's going to manufacture it, how much does it cost to implement this, how much is it going to save, and it won't be effective until that can be done on a routine basis. Again, harvesting greens. A person stooping, kneeling, squatting, and then you add a cart and that unloads the weight on the back and on the knees. This was something that came from the UW Agricultural Engineering. It estimated it was $150 to build, or that's the parts cost to build, it was $150. So I think the cost assessment is going to be a critical part of this. I'm not going to go into treatment. I think that'll be discussed, but this is what, looking at what is the steps of treatment. Certainly maintaining exercise, weight control, and it'd be interesting to see how much people spend in the treatment of over-the-counter. And I should have used acetaminophen rather than Tylenol. I keep meaning to switch that name. I'm not endorsing any particular brand, but acetaminophen is the ingredient. But it used to be the recommendation is not to take more than 8 500 milligrams of acetaminophen on a daily basis because of the effects on kidneys. And if you think of somebody who has diabetes or hypertension, which is definitely seen in the farm population, you have to think about the impact of taking the over-the-counter medications on other body systems. Actually, the recommendations are changing now, is not to take more than 6 500 milligrams of acetaminophen on a daily basis because of the kidney effects. So you really have to think of all the treatment that's used, whether it's WD-40, whether it's BioFreeze and Icy Hot, which are more topical, but you can absorb this, and then just over-the-counter medications, and what kind of health impacts does that have for people who are trying to control pain. Look at joint injections. Steroid injections give a temporary improvement. Looking at Synvisc, hyaluronic acid to help stimulate the growth of cartilage that has been lost. That doesn't work for everybody. It takes a series of 3 to 5 injections. And if you've got very advanced osteoarthritis, it's not going to do much. A lot of orthopedists really don't recommend it then. Assistive devices, braces and canes, and then moving on to joint replacements. So you really look at where in the stage of development of arthritis is a person, and how can you start to do some preventive measures to keep it from advancing to where you have to do very expensive treatment. I think one of the things that's I think would be a helpful role for AgrAbility is what are recommendations for people returning to work after an injury. I've gone online trying to find information for return to work in farming after joint replacements, and what it took for me is to go through each different orthopedic groups on the web, to have their recommendations for return to work. There really isn't any national recommendations or even from the orthopedic associations. What is a reasonable return to work in farming after you've had a joint replacement? And I think that that's something that would be of benefit to the farm population and to orthopedic groups, because it's not easy information to find. This is what I gathered, that you can be back in the tractor in 6 to 8 weeks after a hip replacement. Up to a year to carry feed, seed, or bales or heavy weights. 6 to 12 weeks before walking with full weight bearing. So there really isn't a lot of good information out there as a guide for farmers to return after some of these joint replacements specific to farming. And we know, and there's a constant evolution as far as the technology, medical technology. They're starting to think of hip replacements at earlier, or knee replacements earlier in life, as the technology improves. There's always been the concern of having to go back and do a second hip replacement because of the lifespan of the joint replacements. But that is changing, and with the technology, it gets more expensive, but you get more, it lasts longer, essentially. I'm going to skip over this because except for just on a rotator cuff, again, just on the impact. If you develop arthritis of where the collarbone hooks into the shoulder, that it can lead to impingement. Impingement puts pressure on the rotator cuff. If you tear the rotator cuff and you have open surgery, you can't use that arm for 6 to 8 weeks. I mean, you can't use it at all if it's open surgery. You can do one-handed work, but just think of the impact on lost time, from a rotator cuff injury. And then the older you are when your rotator cuff tears, you can't be guaranteed of a good outcome. I mean, I see a lot of people, I do disability ratings, I see people after shoulder surgery, hip surgery all the time, And I mean, I see a lot of people that they can't, even after surgery, they can't get their arm beyond that, or they can get their arm up, but they have significant weakness. So it can have some long-term impact, even if it is repaired. So it can have a huge impact on a person's ability to do their work and get back to function. So what I want to finish off with is preventive strategies. Myself, Julia Earle Richardson from the New York Center of Agricultural Medicine and Health, and R.J. Banks, an ergonomist from the California State Workers' Compensation Fund, were asked to present a white paper to the Agricultural Safety and Health Council of America on ergonomic research. And just these are some of the things that we came up with. And we did a literature review. We published the paper. It's included in the list of references. But just looking at preventive strategies, the first part wasn't we did. This is well-known information, but proper tools, decreasing pressure points, providing padding to decrease vibration, reducing activities with high repetition, trying to increase the recovery time, and very importantly, trying to engineer out ergonomic hazards. What can the individual do? Avoid repetitive joint injuries. Try to avoid sprains, strains, fractures. Avoiding jumping and jarring type of activities. That takes its toll over years. Arthritis can develop after an injury. Maintaining an exercise program, stretching on a regular basis, maintaining a good weight, avoiding obesity, get that started at an early age. Using the strongest joint to do the job, going up steps to the strongest leg, coming down the weaker, doing the hardest jobs when the person's the strongest. That may be in the morning rather than later in the day. Installing extra steps, grab bars. For those that already have arthritis, certainly consider it before you get arthritis. Lifts for people that have more significant medical conditions. Making sure there's in the equipment, shock absorbers, air suspension rides, rear view mirrors, so you don't have to turn and develop neck problems. Good footwear if you have certainly if you have arthritis of your toes, feet, ankles, knees. Some shock absorption from good cushioning is important. What tends to be the most effective is shorter and more frequent breaks rather than longer and more infrequent breaks. So getting some time for recovery is important. Just the size of the feed bags, decreasing the size. We already talked about telescoping or suspended hitches. Using feed carts or for other preparation supplies rather than carrying them, having a cart to transport them back and forth, decreased lifting. Something that has to go down, don't put something up higher that you have to lower later. Don't put something down below that you're going to have to raise higher. Try to decrease the activity, putting it in a good position. Some of the other ergonomic issues we mentioned. Certainly with the higher equipment, and that's where we're talking about grab bars, steps, or lifts. I'm out of time. I apologize. I'm going to wrap up here. So we look at best practices. Agriculture is a difficult industry to implement this because of the variation. When we looked at this, we identified 34 different interventions, 17 different commodities. I think it was a couple of years ago. We really need to look at customizing these interventions. We don't have a good method to evaluate how effective the methods are. And when we look at research, best practice is an intervention that reduces ergonomic forces in a large randomized field study. And that has been difficult to implement in agriculture. A lot of pilot studies have been published. There really aren't studies that go across the industry. They're all really rather local and scattered. Two of the best documented ergonomic interventions so far, looking at validation, has been the blueberry rake, 5-minute rest break. As I said, more frequent rest breaks rather than longer breaks, more infrequently for longer periods of time. Smaller tubs, calf weighing device, so there's less lifting of the calves. And as I mentioned, the feed transport cart, scooping practices. So these are some of the other interventions that were validated. But these are some of the issues that go across commodities. Stooping, overwork, fatigue, shovels, the type of equipment that's used, a lot of weight bearing. And one of the things that agricultural industry faces is that the different size of workers, especially there's, I look at Wisconsin, somebody who grew up in Wisconsin compared to some of agricultural workers who have come from Mexico, come from Central America, huge difference in height. And just in dairies, it's an issue for reaching from somebody who's 5'4" to somebody who's 6'2", because it makes a difference on the impact. So these interventions, you look at each, how much leadership can the industry take on this? And I guess that was our presentation to the Agricultural Safety and Health Council, which had agricultural producers. Does it make sense for the commodity groups to lead the research? They won't adopt it unless it's cost effective. So we really need upfront involvement. How does can this be translated to small operations and large operations? And how can we dedicate the resources to health and safety? Look at arthritis. I think it starts with preventing musculoskeletal disorders, as well as looking at the assistive technologies to make it allow people who have arthritis to continue to farm. So, we could all look at starting arthritis prevention when younger. We have kids, relatives, looking at activity, looking at the type of food that they eat, looking at weight issues. I think we also need better planning for return to work in agriculture after joint replacement. And I would just like to add to what Dr. Field had said and previous speakers, is we really need to get the buy-in and the education and of the impact of arthritis on people working in agriculture. I think it's a critical issue, and I think it has, because of complacency, because it's something that has developed over time. We thought that affects older people mainly. It's an older person issue. We really have to change that thinking and really address the impact of arthritis. So thank you very much. I don't know if there's time for questions or.
Yes, absolutely. That's
Okay.
what I was going to kind of facilitate.
Okay.
I know we're running a few minutes behind, but we do have a few minutes if anyone would like to ask any questions of Dr. Kirkhorn before we move on to our break and our other opening sessions.
Sir, I know you didn't really get a touch upon treatment recommendations for arthritis, but in your experience, have you used or recommended glucosamine with confortin? And if so, what kind of percentage benefit do you see patients that use that with?
The question was about use of glucosamine for arthritis, and I do recommend it. I've generally recommended 1,500 milligrams a day of glucosamine. There's been questions about the combination glucosamine and chondroitin sulfate. There are a lot of preparations out there, and and there have been controlled studies on some of the brands. But I guess my recommendations have been generally just the glucosamine by itself. I think that's proven to be as effective as a combination. 1,500 milligrams a day, primarily for weight-bearing joints, has been used mainly for knees. Certainly looked at it for hips, but most of the research has looked at knee osteoarthritis. It takes 6 weeks to know if you're going to have any impact from it. And I recommend that people take it up to 12 weeks before they decide it's not going to work for them. But I do recommend it, and I don't want to use it. I don't want to use a brand name without having the information in front of me. But I can't say that for shoulders, wrists, ankles, whether that's effective. Most of it is focused on knees. Back also, I can't say if it's effective for back. Most of the research is focused on knee osteoarthritis. Sure.